Don't let your guard down. That's a tip for the week 35 in our series of 40 tips to 40 weeks. Well, just when you're about to finish the journey of pregnancy, when you're about to reach your full term, another few weeks, that is 37 completed weeks when you reach your full term, we may feel a little complacent. We may feel a little careless. We may feel a little fatigued. We may feel a little tired. Or maybe we are a little excited to get the baby in our hand. Doctor, I've been waiting for my baby for such a long. I want it now. Enough. I'm tired. I can't sleep well. I can't breathe comfortably. I can't sit comfortably. My back is paining. My GI tract is gone for a toss. I have to keep on going to pee all my night. So all these factors are actually a little frustrating. But still, don't let your guard down. Well, this is a very important tip. Welcome. I am Dr Mukesh Gupta, Obstetrician and Gynaecologist from Lenest, Malad, Mumbai. And this is a very important tip in the journey of pregnancy where you need to take care of yourself so that you don't land up with any foolishness. For example, I have been always telling repeatedly, and I'm sure those of you who have been following me for some time, you must have heard it so many times from my mouth. You need to protect yourself from three things: exertion, infection, and accidents. And this is what you have to be careful even in this last few weeks. And now it is all the more important because now when you're just about to finish, you unnecessarily push yourself and exert yourself to achieve some tasks which you feel otherwise will not be easy for you to complete. For example, okay, doctor, I may not get a chance to, go out afterwards once the baby comes. So let me finish this, let me finish that. You may have a tremendous amount of pressure in your office because you want to wrap up the things and hand over the responsibilities to someone else before you take your maternity leave. You may have to be taking care of your very, very, very dependent husband, and you may have to finish up so many things that you want to wrap up for him so that he doesn't have a problem when you're in the hospital or when you're away, or maybe you're traveling to your mother's for the delivery. There might be an issue about taking care for your baby's shopping and baby's nursery and the baby's things and baby's crib and baby's so many things. But there is also another component of you thinking that now I am tired and I'm fatigued because I can't take this anymore. All these things make you feel that you really exerted a lot. That brings us to another important issue, that is accidents. I will give you an example of a girl who had been, careful all through the pregnancy, and just before, in the last few weeks, she was trying to have a bath and the geyser was not on. Suddenly she thought, let me boil the water on the gas, and she spilled the water on her leg. And imagine the girl with burns in her final few weeks. It is so much more difficult to handle. It was a poor, really sad thing. But you need to be careful and learn from others' mistakes. There was this another girl who was actually in a hurry in her office because she was wrapping up the things, and she twisted her ankle at the main gates of her office and she had a fracture of the ankle. Imagine how she would have delivered on the labor table with a fractured ankle. So I can go on with these stories where the girl slips in the bathroom or she just falls off from the chair because of not being careful. You need to be careful about your accidents. Don't try to push yourself and exert yourself and land up in uncomfortable situations where you may not be aware of the things around and you may land up. Imagine the number of times you walk to the bathroom in the middle of the night and the risk you can land up with slipping if you're not careful. I had a girl who was brought during pregnancy where she had fractured her facial bone because she hit against the door, the frame of the door in the night while going to pass urine. So there are so many such stories. So that's why I always say, don't be complacent. Don't let your guard down. The last component is the risk of infection. Well, you do not want the infection. COVID is here to stay. And it's not just the COVID. It is also about influenza. It's also about typhoid. It's also about chicken pox. It's also about any of these infectious diseases that can be passed on. Or it can be as simple as vaginitis or urinary tract infection which can affect you. So you need to be careful. Imagine a girl who lands up with a malaria or a dengue fever during the journey of her labor. It is so much more difficult for us to manage. The most dangerous thing is hepatitis, where we are worried, which can be easily transmitted through your simple, outside food or a juice or a cube of ice which has been infected by a hepatitis B virus. So you need to be careful about all these things. Infections are really troublesome, especially when you land up with them during your last few weeks, at the time of delivery, or immediately after the delivery. I had this girl who had not taken her typhoid vaccine before pregnancy, and she landed up with typhoid immediately after her delivery at say 1.5 months, the moment she started eating outside food. and she was hospitalized. Imagine the plight of the child at that time. So I'll repeat once again, don't let your guard down. Protect yourself when it comes to infections, when it comes to hygiene, and when it comes to exertion, and of course prevent the accident. Take care of yourself. Stay safe, stay healthy. Thank you.